Have you heard of colorectal cancer? In this video, I'll tell you everything you need to know about it. Colorectal is a term that merges the colon and the rectum. The colon plays a major role in the absorption of water and certain minerals. Like its counterpart, the rectum, they serve as a reservoir for undigested food which is passed out as fecal matter. Colorectal cancer describes a situation in which normal cells of the colon and rectum start to multiply abnormally and in an uncontrolled manner, causing harm to other body cells. It is the most common type of gastrointestinal cancer, ranking second on the list of most deadly cancers. Who is at risk of colorectal cancer? Non-modifiable risk factors include age older than 50, being of African descent, having a first-degree relative such as a mother, father, or sibling that has suffered from the disease, and certain genetic predispositions. Modifiable risk factors include smoking, alcohol abuse, physical inactivity, being overweight or obese, overwhelming history of abdominal irradiation, and poor feeding habits with principal consumption of foods rich in fats, salt, red or processed meat, but low in vegetables. Diseases such as inflammatory bowel disease and type 2 diabetes also pose as risk factors for the onset of the disease. So what are the warning signs of colorectal cancer? The symptoms are generally unspecific. They include loss of appetite, tiredness, unexplained weight loss, nausea, and vomiting. Very commonly, patients experience abdominal fullness, abdominal pain, diarrhea, and/or constipation. The most alarming symptoms are bloody stools or bleeding from the anus. Do you want to prevent colorectal cancer? Here are a few tips. The first is to evict and avoid risk factors. So, reduce alcohol intake, stop smoking, do regular physical exercise, and eat a healthy diet. A healthy diet is one that is rich in fruits, vegetables, and fiber. You would also have to diminish consumption of salt, fats, oils, red or processed meat. Maintenance of adequate hydration is equally important. Finally, regular screening is recommended as follows. For the general population, screening is from age 50 or age 45 for people of African descent. If you have a family history of colorectal cancer, then screen by age 40 or 10 years earlier than the age when your relative was diagnosed. The common screening technique for colorectal cancer is a colonoscopy. This is a procedure in which a camera is inserted into the anus in order to examine the rectum and colon. This helps investigate intestinal signs and symptoms and helps the doctor explore possible causes of abdominal pain, rectal bleeding, chronic constipation or diarrhea, and other problems. If you experience some of the symptoms mentioned, be sure to see a doctor. Let us prevent colorectal cancer.